supporting students with special needs. Additionally, she has worked as a contractor interpreter with the Tennessee Language Center since 2017 and became a certified medical interpreter in 2018. In 2023, Effett expanded her contributions by teaching adult English as a second language part-time with Workforce Essentials. Most recently, in August of 2025, she earned certification as an educational interpreter. She is deeply committed to bridging language barriers and empowering her community through her work. Today, Effett joins us to enhance our understanding of Arabic culture and explore strategies for addressing cultural differences in healthcare, all in support of the project's goal to provide respectful and the best care for all patients. Welcome and thank you for joining us, Effett.
Thank you so much. I'm so glad to join you to represent the TLC and speak about our culture of Arabic. So I will go ahead and share my screen. And thank you. I hope you learn a lot about the Arabic people today, and I hope you get benefit from it. You can go ahead and go to slide 2. Okay, for our objectives for this presentation, I focused on improving our knowledge about Arabic culture and identify the differences and challenges that affect the care of Arabic patients. And while we're speaking, we will learn some tips to use it. Next. First, allow me to bring some facts about the Arabic language in Tennessee. Just after the English and the Spanish, Arabic is the third most spoken language in Tennessee. Around 28,700 people in the state speak it. And I got this fact from the chart, as you see, from the Census Survey for Language over 2017 and 2021 about the home language used in Tennessee. Also, I think it might be some helpful to learn more about Arabic in this one. We have all over the world, we have 25 Arabic dialects, and the largest dialects that used here in Tennessee, 5 of them, and the Egyptian Coptic ranks number 1 as the largest community in Tennessee.
Hello.
Yes. Can you go to the next slide? Yes. These are the most Arabic dialects that used in Tennessee. And as you see, the Egyptian Arabic is the first one. And actually, it is a common dialect that all the other dialects can understand. And about 95% of the Egyptian Arabic immigrants are Christians. Although we speak Arabic, but as I said, 95 are Christians and the rest are Muslims. And most of the Arabic Egyptian who immigrated to Tennessee, not to the USA, but specifically in Tennessee, they are from state of Elminia. That's why we call Tennessee our second Elminia. The second language second dialect is Levantine Arabic, and it's including the Syrians, the Palestinians, the Jordanians, and Lebanese. And then the third dialect is Iraqi Arabic. And the most fascinating thing about the Iraqi people is that they speak Arabic beside their original Iraqi, and which is Kurdish, and they speak Kurdish Badini and Kurdish Sorani. And then we come to the Sudanese Arabic, and then Yemenis. Next. These are the challenges that faced by the Arabic patients. The first one is the language barriers and differences. As you see, we have many dialects, and it's too much, and not everyone know all these dialects. And even if you have interpreters who is a specialist, but also there is some difficulties to understand each other, and that's why some risk can increase, especially if this risk related to the dosage or the way to administer the medications. Also, the second one is the use of medical jargons. Using the technical language can be difficult for the patients to understand, and sometimes it's hindering the communication. And to solve this problem, we ask you to first verify with the patient if he's understanding everything, and ask if they have any questions about the procedures or the medications. Also, the third one is cultural and religious considerations that we have to put in our mind when we work with Arabic patients. That there are three factors affect our thinking and making decisions. The first one, our belief about the illness and the treatments. It's influence all our point of view about the illness, the willing to seek the services and the care, and also it's affect our adherence for the treatments plans. Second point is the stigma in the mental health. Is there is a stigma can be present in the between the Arabic, especially if it's related to the mental health issues, and it makes us reluctant to seek the professional help, especially if it's related to the psychotherapy medications. We prefer to take the somatic medications better than psychotherapy medications. Also, the third one that affect our behavior and our decision is the lack of culture competence. Being unaware of the specific culture sensitivity and needs and the beliefs for the Arabic patients, it makes a disconnection happen between the patients and the care providers. And we will discuss these three points on the next slides. Next. We will focus about, as we said, what driven the Arabic speaking patients. We are so emotion people and spiritual people, and the religion is the number one that affects our thoughts. Whether if we are Christian or Muslims, we both submit with the religion first before we making any decisions. Second one is culture and spiritual values. We both, the Arabic Christian and the Arabic Muslims, we share some of the values and the customs, and but there are some slight differences, and it's also related to the third one is the educational level. Let me tell you that most of the immigrants from Egypt, I'm not sure about other countries, but from Egypt, at least 50% of the Egyptian has college degrees. And the rest of them are between high school degrees or GED. So you might find some people from the Egyptian people understand you completely and comply with the medications and agree with the decisions quickly, and you find some other people who hesitate even to take the treatment because they don't have a complete point of view, complete understanding about the importance of these medications. Next, please. First one is the belief or the religion. We have all the Arabic patients receive illness and with patience and prayers and mediations, and this is because of one core belief in all Arab. We believe that everything is from God. If it's illness, if it's even if it's related to the death or hardship, everything comes from God, and we think that it's like a test from Him to see how patient we are and how we submit to Him. And it's not uncommon for the people who has a good relationship to God to seek religious intervention. Yeah, sometimes you see the ladies before they go to the delivery room, they ask for a time for praying, or they might ask you, for example, to keep a picture of one of the saints, as if they are taking a blessing of these saints during the surgery, because in the Christianity we believe that they are present and they are supporting us. Also, the same with the Muslim Arabic people. They sometimes they ask for prayers first, prayer time before they go into any procedures. And the unforeseen hardship, it is the same belief as the illness. We believe that everything from God. Next, patient names. In most Arabic patient names, each one keep his last name for his own family. For example, my family, we have three last names. I have my last name, my husband has his last name, my kids have their last name. The last name, usually it comes the first name, my name, for example, Ifat Adel Wilson Hannah. This is my name, by the way. So when I write down my last name, I can write it Ifat Hannah or Ifat Wilson. And the same thing for my kids. They can choose their grandfather's name as a last name or the grand grandfather as a last name, but they keep the last name forever. Some families they change their last name when they became citizen, and they all follow the last name for the father who's the household, the head of the household, and it's only happening here in U.S. In our country, we don't have a last name. Each one has a full name. We don't have a last name. Also, we plan ahead for the child's name. We don't like surprises, and we don't like to wait for the last minute to decide. So once we know the gender of the baby, we start to think for at least three names. If we agree for one of them, it's okay. If we don't, we just at least we have three names to choose one of them. Let me tell you something about the babies. I I supposed to say it in the last slide. Um, we believe that all the babies in Christian, we believe that all the babies has to be baptized, for the boys at 40 days and for the girls at 80 days. They have to be baptized to be Christian. So if it's happened and you find one patient and you has a child with a severe illness or a critical something that, and you informed them that that baby is not gonna make it or he's gonna die, they might ask you for a chance to baptize the baby before he die. We don't mind if they live or they die. We accept everything because we know this is the end of the life and everybody is gonna die, and we don't know when. But we believe that everybody who born in a Christian family has to be baptized. So put it in mind if you face this situation. Next, please. Oh, the hand use. In Christian Arabic, we don't mind, we use any hands. But for the Muslim Arabic, they are so specific. They use the right hand mostly and better than the left hand. So whenever you hand the medication or give them objects, or if you want to feed them, yeah, make sure to use your right hand, not the left hand. Next, privacy and dress. Um, this one, like mostly for Muslims, but also Christians follow some of them. In many circumstances, a female Muslim patient, especially women who observe the hijab is the covering head, the thing that they put, we call it scarf, that they put in their head and their body. If you observe a woman that completely covers her face and her body with this kind of clothing, Yeah, you know that they might avoid eye contact and they might avoid handshake. So if it's happened, don't feel offended. For Christian, we it's okay. We can look at the eye and we can shake hands, but we usually don't initiate shaking hands. But we wait. But for the Muslims, if you see someone with a hijab, don't initiate the handshake. Um, also, the staff gender. All the Arabic people, Christian or Muslim, we prefer the same gender when we go to the examinations. But if it's happened that there is no way and there is someone, a male doctor who has to be, um, you explain to them that there is no way, there is no female doctors to present. In this case, you make sure that a third party person present in the room, and preferred if it's one of the family or another nurse who is a female to present in the room. And also, we always don't like to expose our bodies even for the physical exam. So if it happened necessary to do it, you tell them what's gonna happen and why you are going to expose this part of body, and only ask them to expose the parts that you're gonna examine only, not for example, if it's abdomen area, just let them know that it's abdomen area only, and do it quickly and let them cover again. Next. Next. Privacy during hospitalization. After Labor Day, we understand that we have to stay a time in the hospital, maybe a day or more. So if it's happened, please before you go into the room, knock the door first and take time like few seconds to before you enter, or wait for them to respond and allow you to enter. Um, it's because some ladies, Muslim ladies, they need to put on the scarf because no one can see their hair. And some Christian Arabic, if they are feeding the baby, or if they are changing, or they doing something, sitting freely, they can cover up quickly before you come in. Also, when you come in, you explain the reason of the visit. Tell them I'm here to do such and such. For the taking showers, we usually don't like the nurses to come and clean up on the bed, clean us up in the bed. We prefer to get up and take the shower by ourselves, if it's possible. Breastfeeding the baby. All the Arabic women, they like to breastfeed the baby first, especially in the first 3 months, because we believe that the first I don't know the exact word, but the first time to feed the baby is the most important time. I don't know if it's scientifically correct or not, but this is what we believe, that once a baby born, we have to feed him, the breastfeed him. Also, we like congratulations. We like social gathering. So after the given birth, or if you notice in any other departments, if someone is Arabic is sick, you will see that many people comes back and forth, and everybody can come 2 and 3 times to check on the patient and ask how are you doing, what do you need, how can we help you. Um, but at the same time, we believe that if someone has a period, she cannot go and visit the lady who just gave birth. I know that it's not correct, but it's in our culture. If someone has a period, they cannot get into the room where the lady who just gave birth to the baby laying down, because we believe it's gonna have the lady like get a series of bleeding. Um, I know that is not correct, but it's still in the culture, so I just wanted to tell you just in case. Also, we have something about the pregnancy. We also say we usually say never tell until it is installed. If someone knows that, if a lady knows that she is pregnant, we don't tell anybody until they ask, and until it's appear and they say, what's happening, what's going on, are you pregnant? Oh yeah, I am, yes. We always doing like hide your candle to make it to keep it lit, and avoid the envy. um, Also, during the hospitalization time, you might smell some weird smell in the room. That's because we have a special drink we make from the fenugreek. We boil the fenugreek and put a lot of sugar because we believe that it helps the woman to get more milk and feed the baby, that fasten the produce of the milk. Also, we like to eat a chicken soup after we get the baby out. We say once the baby out, the chicken comes in. So we always eat chicken soup and fenugreek. So if you observe or smell that smells in the rooms, that might be Hawaii. And we will speak about the other kind of foods later. Next. The family has a huge effect on the patient, because we believe that the family is number one, and we have a big tie, strong tie together, and we ask all the family members about any decisions or anything before we do. As I said, we even if you choose a name for the baby, we ask all the entire family. I call my parents and my sisters and siblings in Egypt and ask them, I'm having a girl baby. I will have a baby girl. What names do you recommend? And we get like hundreds of names. And I have this issue. What do you think about it? What can I do? So the family has a huge impact and involvement in the patient's life, and especially in making the decisions. For adoptions in the family, that's why we, because the family has a huge impact and strong bond, for the adoption is not recommended on the Muslims families. They don't accept the legal adoption, but they can care and raise children who needs assistance. But these children, they keep their own names. They have to know their own biological parents, and they never considers as one's own. So he doesn't inherit anything from the family. It's considered like assistant, not as his only child. However, if they adopted a child, a baby, and the mother breastfeeds the baby, he gets more merits, but he's still not like he still doesn't take the name of the family, but he considered one of the family, like one of the relatives. But for the Christians, we accept the adoption. We don't mind to adopt the children. Next. For the health, we have a lot of issues with the health. The first one is abortion. It's prohibited in the Arabic culture, whether if it's Christian or Muslims. We prohibit it except in cases of incest or rape, or if the life of the mother is in threaten. If you tell them that you're gonna die, okay, we accept abortion. But if you ask us, for example, abortion because there is a genetic disorder or there is some issues with the child, we say no, it's okay, we keep it, and we accept it as we said at the beginning, we accept it as a test from God. For the That's because We believe that the fetus, once they complete 25 week, we deal with it as if it's a living person. He already has a life and he has the right to come to the world. We always look to the health providers as a helper of God's will. That's why all the Arabic people trust the healthcare providers, and whether whatever you say with explanation, we accept it. We also don't mind do any surgical procedures as permitted. We also there is no restriction in the amputation or biopsy or blood products or medications or amputations. We don't mind all these. For the birth control and the facilitation of the birth control, we accept the temporary birth control because most of the patients, especially the Muslim patients, they will use the control pills for preconceptions, but they will not use post-cocktail options like the morning after pill or the intro how you say it intrauterine. They do not accept the intrauterine devices because they think that it might cause abortion or might cause problems with fertilizations. Um, but in Christian, we accept the birth control, and the no the way of controlling the birth is different according to the education level of the patients in Egypt. The higher education patients, we understand all the type of the birth control and we can choose easily. But for the low education people, they don't understand. All what they know is just there is a bill and that's it. So you have to explain to them what does it do, how will they use it, if there is any side effects. You can explain it to them and let them choose. Just be transparent with the patients about everything about. Also for the sexual transmit intimate examinations, it's forbidden, where all the Arabic people don't do it because we believe that if we do it, especially for the ladies who are not married yet, it can break their virginity, and it's a huge matter in our culture. If the girl got married and they figure out that she's not virgin, it's not acceptable. Divorce has to be done immediately. Um, so we have to be cautious with this one. For sexually transmitted diseases, Arabic and Muslims, we get offended when we speak about it because we believe that it's very, very, very private matters and we don't like to speak about it. But if it's necessary and like, mm, if it's going to affect our safety or anything, we can discuss it. So it's depend on the situation. But in general, we are so reserved about it, and we don't like to speak about it. Also, the sexual relationship and the counseling, we prefer not to speak about it with any male doctor, but we can speak with a female doctor, but after warming up. So it's also have like sensitivity to speak about it. Circumcision, we believe that it has to be done for all the male babies, and we also ask before we leave the hospital to do it for the baby before we leave. The birth defects, Arab preserve that birth defect is a test from God, and it's testing our faith and our patience. Congenital disabilities, We accept it, but in same time, we don't like to speak about it openly in the community. They try to hide the babies or the children as much as we can, so no one can ask about it, about this issue, and we don't like to speak about it. But we speak about with the doctors and the providers to seek help and service for the children. The mental illness is the biggest issue because the Arab people, Christian or Muslim, no one likes to confess that they have a mental illness or mental disease. And as I told you, they always try to seek the somatic medications more than the psychotherapy medications because we believe that it's like a sign of weakness, and it's like a shame and disgrading. So that's why we don't like to speak about it. And sometimes the ladies who has a postpartum depression, they don't agree that they have it. They sometimes believe that it's a change of hormones. That's why we're acting this way. Uh, Maybe sometimes we have depression because we are alone. We don't have our family. We don't have someone to support us. So they take medications, but not a depression medication. The other medications to release the pain or any other medications, but they do not accept the idea that they are mentally um, affected. Next, medications. We will talk about the medications during fasting time and what the accepted medications for Muslims specifically. Um, for Muslims, they eat anything except the pork. They don't like it because it's forbidden in their religions. They are forbidden to eat anything made out of pork or gluten, and that makes it hard for the providers to try to find the correct drug that doesn't have gluten or pork. And also they don't allow the medications that contains alcohol during fasting time, specifically on Ramadan. This is their holy months of all over the year. And the issue in this month is that they have to fast from the sunrise to the sunset without taking anything, without consuming water or food or medicines or anything. And if it's happened and they broke it, they have to fast the day to like compensate the days that they broke their fasting later on in any other days during the year. Um, For Christians, we are fasting too. We are fasting around 2/3 days of the year. But the thing about Christians that during the fasting time, if the patient is very sick and he really needs the medication, he can break the strict fasting and he can take the medication and then continue. For the diet and the food, we're gonna talk about it later. But right now about the medications, um, also I will go back to the accepting medications for the Muslim people. The medications accepted for all the Arabic people. But as I said, for the Muslims, they always try to avoid the medication if it's over the counter or if it's prescribed, even if it's necessary. If it's made of the pork and alcohol, um, so that's why they don't. It's so hard to find it. But if it's emergency and there is no way and they have to take it, you can explain to them that this is the only medication that is available and it's very very necessary for their life. And then I think some of them might change their mind and take it. Next, please. Okay. These are some of the medications during the fasting of Ramadan for the Muslim peoples. The eye drops, the ear drops, the dental care, they accepted. They said yes because it's not going into it's inside their stomach. Inhaler, nebulizer treatments, nasal sprays, they accepted. Immunization vaccines, insulin injects, and difference of opinion. uh, they don't for the injections and the vaccines. Some of them say okay since it's not going to our stomach, and some of them they say no because it's going to our blood. So it like nourishing the body. So some of them might say no, we don't want it. The IV fluids, they all say no, unless it's the patient has a dehydration, and then he can break the fast. Donation of blood, they say no. They do not accept the blood infusion. Oral medications, normally they say no because it's not allowed. Um, you can go to next. Okay, folk treatments. Um, we have some folk treatments and home remedies that we allowed, and make sure these are some of them. So make sure that it's not go against the medications that you give them, and ask them about the herbs and if they are taking at anything from this at home, because some of them are they take it with a huge amount and it can be risky if they use it with another medications. So ask them first. But normally the safe ones is that we say that it's safe. The honey, we use it when we have anything in our throat or if we have coughing. We mix it with lemon and drink it if we have flu or influenza. As olive oil, we replace it with replaces the butter if we are sick. But if not, it's more acceptable than the butter. And also we use the olive oil to as a treatment for the joint pain. We put it as if it's like ointment over the joints and over the bones. Um, that's our tradition remedies. So please ask them before you do anything, before you give them any medications. Next. Oh, first the diet. The dietary requirements and food restrictions for Christians who may be exempted from fasting. Uh, as I said, as a Christian, we fast 2/3 days of the year, but there are exceptions. If the patient is the young children are exempted. The elderly, if they have health issues, they are exempted. The pregnant woman, they are exempted. Um, and any other patient who required to break the fasting, they have to ask first the priest at the church and take like absolution from him and tell him, okay, you can break your fast. Rather than this, we have to fast. What type of food to eat? Non-fasting days, we eat anything. We don't mind, we don't have restrictions. But during these fasting days, some fasting days we eat only vegetables and fruits. And some other fasting, we allow to eat vegetables and fruits and fish. All type of meats and animal production are forbidden during all the days of the fasting. For the Muslim people, the dietary requirements and the food restrictions who may exempted from the fasting, the elderly, the children, the chronically ill people, the pregnant woman. But if they broke their fasting, they have to fast and make up these non-fasting days later on when they are able during the year. So, for example, if they broke 3 days because they are very, very um, uh, ill and they need medications or critical situation, they can make up these 3 days any time else through the year. What type of food they eat? Anything except, as we said, except the pork and the alcohol. What hand to use? As we said, they always believe that the right hand is a clean hand, so they use only their right hand. Um, I would like to say thank you for listening, and I hope um, you got benefit and you learned. And let me know if you have any questions. And these are the references that I used and I got the information from. If you want to go back and review it, there is a lot of information over there that can be benefit for you. Thank you so much.
Thank you so much, Effet. That was wonderful and so informative. Really appreciate you taking the time to be with us here today. And I know that you created that